When you visit your diabetes doctor, they may order tests and labs regularly. Getting labs taken might feel uncomfortable and take extra time, but they keep you healthy and check for other conditions linked to type 1 diabetes. We'll go over the most common tests, what they look for, and why you need testing.
The timing of when you need to get tested will vary based on your age, the American Diabetes Association or ADA guidelines, and your medical history. Be ready for your doctor to discuss your specific plan on a yearly basis, as monitoring is important for your health.
You may need a yearly urine test looking for high microalbumin, a protein in your urine that can be a sign of kidney problems. Since type 1 diabetes can affect the kidneys over time, this test helps catch changes early and can help protect kidney health. People with type 1 diabetes are at increased risk for a condition known as Hashimoto's thyroiditis. This autoimmune disease affects the thyroid, a butterfly-shaped gland in your neck that helps control your metabolism. It can cause the thyroid to work incorrectly, though in some cases it may not cause any noticeable symptoms. This can be checked by a thyroid-stimulating hormone blood test, also known as TSH. If TSH levels are high, you may have hypothyroidism, a treatable condition that can lead to fatigue, swelling in your neck, and problems with growth. If TSH levels are low, you may have hyperthyroidism or Graves' disease, a treatable condition that can lead to weight loss, swelling in your neck, or heart problems. Shortly after being diagnosed, you may need a lipid panel. This blood test checks your cholesterol levels to check your heart health. Cholesterol is a fat-like substance your body needs, but having higher levels can block off blood flow throughout your body, which could lead to heart disease, limb disease, or strokes. Because type 1 diabetes increases your risk of heart problems, regular screening is important. You may also need a dilated retinal exam. This test checks for diabetic eye diseases like retinopathy, cataracts, and glaucoma. These conditions can develop without symptoms, so early detection is key to protecting your vision. Celiac disease is another autoimmune disease associated with type 1 diabetes. It is a condition that can cause damage to the small intestines when consuming foods that contain gluten, such as wheat, barley, or rye. Celiac disease can be present even without symptoms, so it is especially important to get screened if you have a family history. You were likely tested after diagnosis and will continue to be tested per the ADA guideline or based off of your symptoms. Regular visits are important to check in with your team and are required to get supplies and medication. At the visit, your blood pressure will be checked, along with your height and weight, to look for unexpected changes. Your doctor will also check your feet for signs of diabetic neuropathy, also known as nerve damage. You should routinely get vaccines that are recommended to protect your health.
Try to see your doctor every 3 months, unless advised otherwise, and make sure to set aside time to get your labs taken. Regular visits and testing may feel scary and like a hassle, but they play a big role in preventing complications and keeping you healthy.